Thanks to the Heart Failure Society of America for these resources. To diagnose congestive heart failure after these signs and symptoms are looked at by the physician, again, they will always do a physical exam. Use auscultation to listen to the heart, listen to different functions, check out the patient, palpate, etc., right? Then they're going to do a health history, talk to them about their subjective history, family history, etc. And they're going to order an EKG. You'll be performing that, make sure it's accurate. And we may end up ordering an imaging through a cardiologist or some other vascular study for echocardiogram, check out the function of the valves, check out the actual physical heart muscle, look for a CT scan, see any enlarging, may order a chest x-ray to see cardiomegaly. Really definitive for diagnostics as well as to monitor how well someone is controlling their congestive heart failure, how well the treatment is going. It has to do with a BNP, which is a B-type natriuretic peptide test. So it's a blood test where they check out the BNP level of a patient, and that is released in the presence, it's a protein that's produced by the heart in the presence of having to overwork and damage. So if the heart is overworking, it's going to release B-type natriuretic peptide, and an elevated result can speak to congestive heart failure or continuing damage occurring. How to treat it? Well, let's prevent it. Diet low in salts and low in bad fats, trans and saturated fats low. Physical exercise, that'll help prevent it, but once a patient is diagnosed with congestive heart failure, physical exercise really needs to be regulated in the way of a cardiac rehabilitation program. This may involve an extensive healthcare team and a cardiologist, etc., but it really has to do with a really regulated exercise regimen where they can only do certain things, they can't work through any symptoms, etc. But physical exercise is a huge piece to try and get that muscle of the heart working on its own again so it doesn't have to tire out all the time. Watching water intake, you'd think it'd be pretty easy to tell every patient on earth to make sure that you're drinking water, but not necessarily congestive heart failure patients. They need to watch their water intake because the more water we intake, the more increase in blood pressure they have because the more volume inside their vessels makes the heart work harder. So patients with CHF really need to watch their water intake. That really needs to be regulated by a physician. Common prescriptions, not only for congestive heart failure, but cardiovascular disease in general, hypertension, different, if you're at risk for atherosclerosis, coronary artery disease, carotid artery disease, etc. We want to make sure the heart isn't working as hard as it needs to. We need to make sure the pulse slows. A lot of these medications work in different ways, but they all benefit the cardiovascular system. The 5 that I'd like you to know for this module are metoprolol, losartan, hydrochlorothiazide, which is also said HCTZ, lisinopril, and nitroglycerin, which is a sublingual tab that is taken that opens up vessels that helps with angina or heart pain. Always take good vitals. Make sure you're always getting a good blood pressure reading. If it's falling too fast, you're not getting it accurate enough. If you're not sure what it was, take it again. EKG, good accurate EKG, limit those artifacts. Communicate with your patient, make sure they're comfortable. You're going to set up a bunch of referrals, most likely for imaging studies or cardiology. Education, make sure you're talking to the patient. Don't just exercise through congestive heart failure symptoms like chest pain or feeling excessive tiredness. A lot of that rehab is going to be regulated by someone else unless that's your job. But for the most part, we just want to make sure they understand their disease, they understand what their physician wants them to do, and what they don't want them to do. Make sure they're getting their refills, just like everybody. Don't sleep on your refills.